But there is no doubt in my mind that we will stop it here.
Pretty clear and definitive words from Dr. Tom Frieden from the Center for Disease Control yesterday, speaking about this patient in Texas who is now confirmed as the first U.S. Ebola patient. Joining us right now, Stephen Morrison, Senior Vice President and Director of Global Health Policy Center at the Center for Strategic and International Studies. Thanks for joining us, Mr. Morrison.
Thank you.
So do you agree with Dr. Frieden there in his assessment? Yes, it's possible that people may have had contact with this individual, but there's no doubt that we're going to stop Ebola right where it is.
Well, I think that what Tom Frieden, head of CDC, is saying is that the systems are in place at the Presbyterian Hospital there in Northeast Dallas to isolate the patient, to do the contact tracing of the family and community members who had possible exposure to that patient, and to quarantine those people who may have been exposed, and that those procedures, if they are carried out successfully, and every indication is they should be carried out successfully, will contain this.
All right.
And I think that's a realistic and fair assessment of what the capacities are there at that community hospital.
Well, let me just ask you, because I think the American people, when they hear about this case in Dallas, I don't think they're overly alarmed. But let me just ask a couple of questions. The president said that it was unlikely it would ever come to this country, yet here it is at this country. We know that some healthcare workers and the paramedics who worked on this guy before he was isolated in the ISO ward there in Dallas are now under observation. We don't know who this guy came in contact with as he carried out his daily life in and around the Dallas area before he was actually taken to the hospital. This could be a bigger thing than it is at the moment, could it not?
Could be. The investigation right now is to determine how many people he had contact with in the period from the 24th of September.
Well, that's a very difficult thing to know, though, isn't it? Isn't that a very difficult thing to know?
Well, we do this. The United States and other governments, public health officials, do this sort of tracing and investigative work in many other instances. The Middle East respiratory syndrome, MERS case, there were 2 cases that came in to the United States this year on aircraft where people on the aircraft were exposed. In one case, there were over 500 people who were traced. And wow. the outbreak was contained. So this is, and we have past cases of other hemorrhagic fevers introduced into the United States and into Britain and elsewhere where these procedures were used. So I think that there is a record of when you have the systems in place, there is a record of containment.
So let's be clear on how one might get Ebola. When we talk about being exposed to someone who has Ebola, that in and of itself does not make you susceptible to the disease. My understanding is that you have to have direct contact with bodily fluids. That means vomit, sweat, blood, urine, saliva, and only when that patient is exhibiting symptoms of Ebola. Is that correct?
That's correct. This is not an aerosol-borne. It's not an airborne virus. So it typically is passed to family members and to healthcare workers. Those
who are caring for someone who has it.
In very close, personal, intimate contact with the patient as the patient becomes symptomatic, and that's where the transmission happens. And so, in order to break transmission, you have to isolate, and those who are caring for the person have to have adequate protective gear on and have to follow a very closely disciplined regimen.
But let me ask you a question. If the guy walks into a convenience store and sneezes while he's symptomatic, is it possible to catch it that way?
No.
No. What? But that would be,
it's not airborne.
He'd have to sneeze on someone, right?
He'd have to have an exchange of body fluids, or blood. And it has to be a more serious method of transmission. Now, you're right that if he is circulating, and there was a 4-day period between when he became symptomatic. He only become contagious once the symptoms have developed. And he was not symptomatic when he left Liberia, nor was he symptomatic when he arrived in Dallas. But 4 days later, he began to get ill. And there was a 4-day gap between then and when he went into isolation at the hospital. So all of those contacts that he had in that period are the ones that are going to be a cause for investigation and concern right now.
Right.
And my guess is that based on what Dr. Frieden said yesterday, the early indications are that his contacts were fairly limited in that period. And I think the point you're making is this case could have been far worse if he had been if he had been very symptomatic, and if he had had close interactions with a much bigger range of people.
And just really quickly, what are those early symptoms? Is it easy to confuse it with just a virus or a head cold or a flu?
Yes. The early symptoms are flu-like symptoms. And so when he went to the hospital and for his first visit on the 26th, he was given some antibiotics. They did not diagnose it as Ebola. They told him he had a general flu-like condition and he should just go home and rest.
Right.
They did not. And this gets to another very important point, which is there is no rapid test for this. And they did test him and confirm on the 30th. They checked him in, put him into isolation on the 28th. It took a bit of time to do lab confirmation. But one of the technical gaps that exists with Ebola is there is no rapid test. Otherwise, they could have done that on him when he first came in. If they had enough, if they'd been alert enough to connect the dots. He didn't. I don't know that he disclosed when he came in that he had begun a journey in Liberia on the 19th that brought him to Dallas. If he had disclosed that in his first encounter, the health officials would have followed a different set of procedures.
Gotcha.
When he came in on the 28th in far worse condition, he did disclose that he had come from Liberia.
And then that set off the signals. All right, Stephen Morrison, we got to leave it there, but thank you so much for that. Really good information.
Appreciate you helping us out understand this thing.
Again, Stephen,
thank you. Thank you very much.
Thank
Have
you.
a good day.
Again, Stephen
Bye.
Morrison is the Senior Vice President and Director of Global Health Policy over at Center for Strategic and International Studies.